Okay, so this gets us to our next question, that is caspase independent programmed cell death is. देखो, in our previous subsection we saw necrosis and apoptosis. Now the examiner has asked you caspase independent programmed cell death, ABCD. Answer बचे. Whenever I ask this question in a face-to-face class, normally students tend to mark it as necrosis or apoptosis, but no. देखो, programmed है ना, programmed cell death, तो necrosis is out. Caspase independent. Apoptosis क्या है? Apoptosis is caspase dependent in nature. So caspase independent. Apoptosis is out. क्या बचा? You are left with necroptosis and pyroptosis. Pyro मतलब fever. Pyro मतलब fever. That is, it is apoptosis associated with fever. So the answer by default that is left in this case is necroptosis. So let us now have a detailed look at necroptosis. What do we mean by necroptosis? What does necroptosis mean? देखो, let us assume the extrinsic pathway of apoptosis is activated. Let us assume extrinsic pathway of apoptosis is activated. Extrinsic pathway of apoptosis, this in turn leads to, which is the initiator caspase of extrinsic pathway? Remember extrinsic pathway, two friends came from outside, 8 and 10. Which is the main initiator caspase? Caspase 8. This in turn leads to activation of caspase 8. This leads to activation of caspase 8, which goes to executioner caspases, which in turn goes to executioner caspases and apoptosis. This is the normal routine pathway of apoptosis. This is normal, you know this. But suppose there is failure of activation of caspase 8. There is failure of activation. There is failure of activation of caspase 8. Because of failure of activation of caspase 8, this in turn is associated with mitochondrial damage. Failure of activation हुआ ना, mitochondrial damage, reduced ATP in turn leading to necrosis. So what started as apoptosis ends as necrosis. This is called as necroptosis. It started as apoptosis, ends as necrosis. So I can safely say necroptosis is programmed or non-programmed? Programmed, because it started as apoptosis na, so it is programmed. Caspase dependent cell death. It is programmed. Caspase independent cell death. Why caspase independent? Because there was failure of activation of caspases. Next point, biochemically it is apoptosis. It started as apoptosis, so biochemically it is apoptosis, but morphologically it is necrosis. It ends as necrosis. There was failure of activation of caspase, which in turn leads to mitochondrial damage and necrosis. तो इसमें inflammation भी होगा, it will be associated with inflammation. Morphologically it is necrosis. This is called as necroptosis. Next point. अच्छा, इसमें एक term और देखते हैं. Let us have a look at pyroptosis also. Let us have a look at pyroptosis also. Pyro means fever. So it is fever associated apoptosis. Apoptosis है ना, so programmed है कि non programmed है? Programmed है. So it is programmed cell death. First point, it is programmed. It is programmed cell death associated with fever. So it is characterized by release of fever inducing cytokine. It is characterized by release of fever inducing cytokine. That is, which is the most potent pyrogen? Which is the main cytokine that causes fever? We'll do this in our next chapter, inflammation. But which is the most potent pyrogen or which causes fever? Interleukin 1. It is characterized by fever-inducing cytokine interleukin 1. Next point, and is associated with formation of inflammasomes. देखो, all these are the words which are asked in MCQ. जैसे ही pyroptosis है, pyro, fever, interleukin 1, cytokine interleukin 1, associated with formation of inflammasome. Formation of inflammasome. Which are the main caspases associated? Caspases, it is associated